My name is Dennis Mills, and I'm a veteran from the way back when, 1966 through 69. I'm also a licensed VA claims agent, but more importantly, lately, I've been using EFT, Emotional Freedom Technique, with veterans who are seeking VA claims. And with us tonight is an unusual gathering. This is a typical gathering that is meeting on a regular basis at Joint Base Lewis McChord, where a group of very dedicated people meet together to help people overcome stress, pain, other type of issues, using a technique that you've probably seen the program earlier when we talked about Emotional Freedom Technique. And so I'm going to sit back and be part of the group that meets, because I've never been part of your group, but I'm a willing volunteer to come to Joint Base Lewis McChord. And the idea is that this type of program can be replicated throughout anywhere that there's a military base. And so I'm going to turn it over to you.
All right, thanks, Dennis. So the way we usually start our groups is we just have an introductory tap. It kind of gets people relaxed. So everybody, if you would, and I'm assuming that everyone here knows something about EFT. If we had brand new people, we'd talk a little bit about what EFT is. But we're just going to jump right in there and start with, go through the points. And if you would all just repeat after me and tap. Even though I'm doing this silly tapping.
Even though I'm doing this silly tapping.
I accept myself anyway.
I accept myself anyway.
And even though this looks kind of weird.
And even though this looks kind of weird.
I can't possibly be doing this.
I can't possibly be doing this.
I accept myself anyway.
I accept myself anyway.
And even though this can't help.
And even though this can't help.
It's just too strange looking.
It's just too strange looking.
I might try to have a little bit of an open mind.
I might try to have a little bit of an open mind.
Because I say a lot of people get helped with this tapping.
Because they say a lot of people get help with this tapping.
And I accept myself completely.
And I accept myself completely.
This silly tapping.
This silly tapping.
Ah, it looks pretty strange.
It looks pretty strange.
Why am I doing this?
Why am I doing this?
Maybe I'll have an open mind.
Maybe I'll have an open mind.
Even if it looks silly.
Even if it looks silly.
So I'm just going to tap along.
So I'm just going to tap along.
And we're all going to look silly together.
We're all going to look silly together.
This silly tapping.
This silly tapping.
Okay, everybody take a deep breath. Okay. Thank you all for being here. So does somebody, I think to start out our borrowing benefits group, what I'd like you all to do is just think of an issue that you're having right now, some kind of, it might be physical pain, it might be an upset, and just think silently to yourself, if you were going to give it an intensity number from 0 to 10, what would it be? And then think about where the location of that, where the pain is, and if there's an emotion, where is that pain located in your body? So just take a moment. And then I understand, Sean, you're going to volunteer?
I guess so.
Okay. All right. So what have you got today?
I would say I got stress about a 7, worrying about my discharge from the Army and what it holds after that.
And where are you feeling that stress?
Kind of in my upper shoulder region, in the back, kind of.
And what's the sensation in your upper shoulders and back?
Kind of feels like there's pressure on it.
Okay. Okay, we're going to just start tapping on this, and everybody else tap along and repeat after me, and tap, and you'll be tapping on your own issue, whatever that is. Okay, side of the hand. Even though I have this stress in my upper shoulder and back,
Even though I have this stress in my upper shoulder and back,
I'm worried about getting out of the Army.
I'm worried about getting out of the Army.
I honor and respect myself.
I honor and respect myself.
And even though I have this upper shoulder and back stress,
Even though I have this upper shoulder and back stress,
all this pressure,
all this pressure,
I'm worried about getting out of the Army.
I'm worried about getting out of the Army.
I accept myself
I accept myself
and all these feelings.
and all these feelings.
And even though I'm worried about getting out of the Army,
And even though I'm worried about getting out of the Army,
and that stress is in my upper shoulders and back,
and that stress is in my upper shoulders and back,
I completely accept myself.
I completely accept myself.
Okay, top of the head. This stress in my upper shoulder and back,
This stress in my upper shoulder and back,
I'm so worried about getting out of the Army.
I'm so worried about getting out of the Army.
I don't know what's going to be happening.
I don't know what's going to be happening.
Now, you tell me if I don't, I want you to say if this is exactly what you're feeling, okay? I'm going to use your words, but if I don't get it right, tell me. This pressure in my upper shoulder and back,
The pressure in my upper shoulder and back,
worrying about getting out of the Army.
worried about getting out of the Army.
This worry and stress in my shoulders and back.
This worry and stress in my upper shoulders and back.
This worry and stress in my shoulders and back.
This worry and stress in my upper shoulders and back.
This worry about getting out of the Army.
This worry about getting out of the Army.
Okay. Take a deep breath. So, what'd you notice?
Feels a lot lighter on my back.
What'd you
Still
say?
like a feeling of like a 5. It's not like,
It's a 5?
it's not worry anymore. It's more like helplessness that I can't do anything about it. So
So you're feeling a helplessness feeling, you can't, and are you still feeling it in your shoulders?
It's like it's moved up like to the top of the shoulders.
Okay,
There's not as much pressure anymore.
okay. And what's the sensation in your
It's like trying to like push downwards almost, but
pushing
then
down?
downward, and then
downward?
like letting go, kind of.
Okay, okay. Okay. So let's just tap on that, and it's still there, so we're going to use the term, even though I still have this sensation in my shoulders, I'm feeling helpless, okay? Okay, everybody. Even though I'm still feeling this sensation in the top of my shoulders,
Even
Even
though
though
I'm
still
feeling
feeling the sensation on top of my shoulders,
it's this helplessness.
it's this helplessness.
I'm worried about getting out of the Army.
I'm worried about getting out of the Army.
I completely honor and respect myself.
I completely honor and respect myself.
And even though I have this, still have this helpless feeling in my shoulders,
Even though I still have this helpless feeling in my shoulders,
I'm stressed and worried about getting out of the Army.
I'm stressed and worried about getting out of the Army.
It's pushing down on my shoulders.
It's pushing down on my shoulders.
I completely accept myself.
I completely accept myself.
Was that 2 or 3?
2.
Okay. And even though I feel this, still feel this stress in my shoulders,
Even though I still feel the stress on my shoulders,
feels kind of like helplessness.
it feels kind of like helplessness.
I completely accept myself,
I completely accept myself,
and I accept that I have all these feelings.
and I accept that I have all these feelings.
This worry about getting out of the Army,
This worry about getting out of the Army,
It feels kind of like helplessness.
It feels kind of like helplessness.
It's like this pressing down on my shoulders,
Like just pressing down on my shoulders.
this worry over getting out of the Army.
This worry about getting out of the Army.
It's kind of like helplessness.
Kind of like helplessness.
It's down to a 5.
It's down to a 5.
Feels a little different.
Feels a little different.
It's still the stress and worry about getting out of the Army.
Still the stress and worry about getting out of the Army.
And I'm open to changing it.
And I'm open to changing it.
And I'm open to being surprisingly okay with this.
I'm open to being surprisingly okay with this.
I don't know if I can,
I don't know if I can,
but I'm open to it.
but I'm open to it.
This remaining helplessness,
This remaining helplessness,
this remaining stress and worry,
this remaining stress and worry,
I don't know if I can let go of it,
I don't know if I can let go of it,
but I might be open to it.
but I might be open to it.
Maybe.
Maybe.
Okay, take a deep breath. What are you noticing?
There's like nothing there.
There's what?
There's like nothing there.
There's
Like
nothing there? Nothing?
No, like when you said letting go, I kind of just let go. I'm just gonna let it happen.
Oh, okay. Okay. Okay, what occurred to you was I am letting go of it. I'm just going to let it happen. Is that okay? And let's do what in the support groups that we have, when we get down and do a low intensity and a person begins to talk in a more positive frame, we'll do a positive tap to help the body feel more positive in that new direction. So we're just going to do one quick round on this sort of letting go, or this feeling of letting it go. How are your shoulders?
Good.
Good?
Feel loose.
Your shoulders feel
Yeah.
loose?
A lot looser than they did before.
Can I quote you on that?
If you want to. I can autograph it for you too.
All right. Okay. All right. So this time with a positive round, we're not going to have to start with the side of the hand, because we're just kind of helping the body be in a more positive frame of mind. So we're just going to start right here. I'm getting out of the Army,
I'm getting out of the Army.
and I'm just going to let it happen.
I'm just going to let it happen.
I'm letting go of this stress and worry.
I'm letting go of this stress and worry.
And you tell me if this isn't exactly how you're feeling. This could be interesting.
This
Could
could
be interesting.
I think I might be up for it.
I think I might be up for it.
In fact, I am up for it.
In fact, I am up for it.
Even my shoulders feel loose.
Even my shoulders feel loose.
That's pretty cool.
That's pretty cool.
Yeah, I'm just letting go.
Yeah, I'm just letting go.
One foot in front of the other.
One foot in front of the other.
Getting out of the Army.
Getting out of the Army.
Kind of an adventure.
Kind of an adventure.
I'm letting go.
I'm letting go.
And my shoulders are feeling loose.
My shoulders are feeling loose.
Here I go.
Here I go.
Okay, how you doing?
awesome.
Okay. So that felt complete.
Do you
Okay.
ever test to see if they can bring back the stress or the pain, just to see how effective that is?
That's a very good point, and usually we do. Is there what could we do to see if you could, can you possibly bring back being, what's the worst thing that could happen getting out of the Army?
Do some push-ups.
Worst thing that could happen?
Yeah. Can you pull up some worry about it?
I don't know. I could get a bad discharge, but either then, there's a way to get out of it. So I mean, there's not a way to get out of it, but there's ways to deal with it.
Mhm.
There's ways to go on and move on. So really,
Okay.
don't know. I couldn't really think of them. We get homeless, but I mean, there's always options to move on and let go and let things happen. So.
Okay. Would you suggest anything about testing for that more?
Well, when we do tapping with a number of people and they get the lower scores there, we often wonder, is this sticking or are there other aspects that I didn't cover that may be hidden somewhere? Because we sometimes get very excited, particularly if a person's at a 7 or an 8, and then all of a sudden it goes down to a 2, we're thinking, yes, you know. But beneath that 2, there can be a 6 or a 7 or other aspects that we haven't covered. And so one of the things that I encourage people to do is to test how well that EFT procedure worked. And that's where we said, can you bring back that anxiety? Can you bring back that worry? Can you bring back that pain to the shoulder? And Sean, you showed that, no, I mean, hey, it's loose and that's fine, which is an effective test. And so that's why I brought it up, because sometimes, you know, and this is the old professor coming through, you know, I always want to test to see, did they really learn what I was trying to cover? You know, so pardon my professional thing
That
of
was
just
great.
saying that, no, let me test them to see if they passed, you know.
Well, you brought up a good point. Just in the groups that we have on the base, we always make them something that people can learn from. So we're always saying, so what did you see? You know, what did you notice? Do people have any questions? Were there something else? So we're all kind of in a learning situation. And I know I've worked with Sean before, and he's an awesome coach when he's the coach. So because we break it down into dyads and have people practice.
Well, and we can also look at bodies too, because sometimes the shoulders are up here when they start, and then all of a sudden they're down, they're relaxed a little bit, or their chest is up here, and then they're down here, or the breathing is different, type thing. The other thing that we don't have here that I've seen some people use in addition to the deep breathing is a glass of water. Now, I know Elena Frank is very keen about having a glass of water, as well as Dr. Wiener, who said, no, have a glass of water. Because we often think about, we don't hydrate enough. And
we
that has been
yeah.
very effective.
We supply water.
You do
at our
supply
meetings.
water there too. Oh,
Yeah.
great,
Yeah.
great.
I want to circle around with people and people who wrote down their SUDS, the SUDS numbers, the intensity of the either pain or emotion you were feeling. What happened with yours?
That's lower, about 2, went from a 5 to a 3.
Okay. How about you, Stu?
I didn't necessarily have the same sensation of my shoulders, so I kind of imprinted my own and started probably at about a 7 or an 8 and went down to probably about a 4.
Okay.
I went from a 6 to a 2. I wasn't really thinking of anything, I'm sorry.
I went from about a 7 to a 4.
Okay, great.
From about a 5 to a 2. I also did a 5 to a 2.
I also did a 5 to 2 as
I'm
well.
sorry, yes.
Yeah.
I forgot about you.
Well, I was quietly tapping. And I was borrowing the benefit.
Yes, you were. You were. How about you, Lil?
A 6 to a 2.
Okay, great. All right. Thank you, Sean. Okay. So Amanda is going to do the next.
Thank you.
And at this point in our groups, we would usually do just one of the borrowing benefits session that we did, depending on how long it takes. And then we have an opportunity to break down into pairs. We'll try to get a more experienced person with a less experienced person, so people can develop confidence in working with someone else. So
I'm going to be working with Stu. Hi, Stu.
Hello.
How are you doing?
I'm okay, thanks. How are you?
Good. What would you like to work on?
Feeling a little, I guess, some stress factors going on about being put on a more decisive path, if you will, and some life choices right now
Okay. Where are you feeling that stress
in my head.
in your head? And how 0 to 10?
Probably a definite 8.
Definite 8. Is it a pressure or pounding?
Yeah, it's more like a tenseness, kind of a constant.
So aside from the word stress, how else would you label it?
I don't know if achy is a word, but achy. Like,
Achy.
I don't know,
Is it fear
Like,
or
the lack of direction that kind of leads to that kind of fear, I think. Being able to make a clear
okay,
d- thought or something of that nature.
having a clarity of where you want to go?
Sure.
Okay. Okay. Let's just start tapping.
Okay.
Even though I have this head pain,
Even though I have this head pain,
it's like this intensive achiness
it's this intensive achiness
about this making a decisive path.
about making a decisive path.
I still deeply and completely accept myself.
I still deeply and completely accept myself.
Even though I have this intensive head stress
Even though I have this intensive head stress
about the direction I'm going to go,
about the direction I'm going to go,
can't seem to have a clear path in front of me.
I don't seem to have a clear path ahead of me.
I deeply and completely accept myself.
I deeply and completely accept myself.
And of course, if my words don't resonate with you, you can change them. Even though I have this head pain,
Even though I have this head pain,
this achiness,
this achiness,
when I think about making the right decision for my life path,
when I think about making the right decision for my life path,
it's hard to find that clarity.
it's hard to find that clarity.
I deeply and completely accept myself.
I deeply and completely accept myself.
This achy head pain,
This achy head pain,
it's very intensive.
it's very intense.
This head pain,
This head pain,
I have a lack of direction.
the lack of direction.
It's hard to find that clarity.
It's hard to find that clarity.
This lack of direction,
This lack of direction,
I feel it in my head.
I definitely feel it in my head.
It's the 8.
It's definitely an 8.
It's a solid 8.
That's a solid 8.
This lack of direction,
This lack of direction,
it's hard to know what I'm supposed to be doing with my life.
it's hard to know what I'm supposed to be doing with my life.
The clarity is not there.
The clarity is not there.
This lack of direction,
This lack of direction,
I feel it in my head.
I feel it in my head.
This stress in my head,
The stress in my head,
all this stress.
all the stress.
It's a deep breath in. And you still at 8?
No, I definitely would say I'd come down a little bit, so probably 6 or 7.
Okay. So, and anything come up for you doing that?
I don't know, one of the words that you used that I didn't say like really resonated with me, and I think it was just that focus of the word you said.
The lack of direction?
Yeah.
Or, yeah.
I think it just seemed to kind of like really, like key it in for me.
Okay. All right. So even though I still have this head pain
Even though I still have this head pain,
with the lack of direction I have,
with the lack of direction that I'm having,
I deeply and completely love and respect myself.
I deeply and completely love and respect myself.
Even though there's still this pain in my head,
Even though there's still this pain in my head,
finding that direction
finding that direction
and not having that clarity,
and not having that clarity,
I deeply and completely accept myself.
I deeply and completely accept myself.
Even though there's this remaining pain in my head,
Even though there's this remaining pain in my head,
thinking about making the right decision for my path in life,
thinking about making the right decision for the right path in my life,
not having that clarity,
not having that clarity,
it's very hard.
It's very
very
hard.
hard.
I deeply and completely accept myself.
I deeply and completely accept myself.
This remaining pain in my head,
This remaining pain in my head,
it's very achy and intensive.
it's very achy and
Is
intensive.
that still true?
It's getting less.
Getting okay, but it's still achy, kind of.
Sure.
This lack of direction,
This lack of direction,
this lack of clarity.
this lack of clarity.
It would be nice to find some clarity.
It would be nice to find some clarity.
I'm open to finding some clarity,
I'm open to finding some clarity,
but right now I'm not seeing any.
but right now I'm not seeing any.
It's hard to know what I'm supposed to be doing with my life.
It's hard to know what I'm supposed to do with my life.
I'm feeling it in my head.
I'm
I
feeling
feel
in my
it in my
head.
head.
This remaining pain in my head,
This remaining pain in my head.
this remaining lack of direction,
This
This
remaining lack of direction.
this achy remaining achiness,
This remaining achiness.
not knowing where I'm going to go
Not knowing where I'm going to
and
go
do with my life.
with my life.
This remaining achiness in my head,
This remaining achiness in my head.
this lack of direction,
This lack of direction.
feel it in my head.
I feel it in my head.
Deep breath in. So where are you at now?
I really, wow, it's like maybe a 2. There's a definite shift in the intensity of it all. It definitely
Okay.
feels like it's much more subtle now.
Great. What, I'd like to do another round. Is that okay?
Yeah, we have about 5 minutes, so we'll
Okay.
just do that. Another
Okay,
round.
all right. All right. Even though there's still a little bit of this achiness left,
Even though
There's still a little bit of this achiness left.
I'm open to allowing some clarity in.
I'm
open to allowing
Clarity in.
I deeply and completely accept myself.
I deeply and completely accept myself.
Even though there's a little bit of remaining achiness left in my head
Even though there's some remaining achiness left in my head
from this lack of direction I've been experiencing,
from this lack of direction I've been experiencing,
I'm open to seeing if just a little bit of clarity will come in.
I'm open to see just a little bit of clarity will come in.
And I deeply and completely honor and respect myself,
I deeply and completely honor and respect myself.
even though there's just a little bit of lack of direction left in my head,
Even though there's a little bit of lack of direction in my head,
lack of clarity.
lack of clarity,
I deeply and completely honor and respect myself.
I deeply and completely honor and respect myself.
This little bit of achiness left in my head,
This little bit of achiness left in my head,
I'm open for a little bit of clarity.
I'm open for a little bit of clarity.
I know it might not come easily,
I know it might not come easily.
but maybe if I just allow myself to be open to it,
Maybe if I just allow myself to be open with it,
it'll be easier.
it'll be easier.
This little bit of lack of clarity,
This little bit of lack of clarity,
allowing clarity in,
allow some clarity in.
a little bit of achiness.
Just a little bit of achiness.
Just a deep breath in. And any changes in that last round?
Yeah, I really can't feel anything in my head right now. I mean, I'm not, it's not like a tension headache that I had earlier. It's just not there at all.
Wow, that's great.
Yeah.
Okay.
See if he can bring it back.
I don't know if I want to bring it back since we have the
Amanda,
time. thing.
rather than have him bring it back, I just want to address one quick thing, and maybe Lil, you could address this. Psychological reversals. There's a term that we didn't present tonight, but this can happen in a tapping circle. Just real quickly, what is it and what can we do about it?
Well, basically, the reason why we use the setup statement is what's understood is about 40% of the time there's a psychological reversal associated with it, which is, basically your subconscious your subconscious trying to protect you. So it's trying to hold on to that indicator or that pain or that discomfort because it feels like it's trying to protect you, except that experience doesn't exist in this moment. So it's just really a memory from a past moment. So that's why we use the setup statement, because about 40% of the time it's absolutely necessary. So instead of guessing, we just use it all the time, and then
Very
we don't
good.
have to guess.
Well, I encourage our viewers to study more about emotional freedom techniques. And what you saw in this segment is a group that you could form together and meet and help provide treatment for each other, treatment for yourself, because we had borrowed benefits as we were tapping on two of you, but all of us received the benefit of doing that. And so we want to thank you for watching and encourage you, if you need more information, to look at the information that's on the screen now. But also, if you want to Google EFT or emotional freedom techniques, this program will be aired a number of times, and you should be able to watch that a couple times, download it, save it, tap along with it as you watch. So as you're watching this program, tap. And as you download a program from the internet on EFT, tap.
We're all under stress, and it can really affect both our minds and our bodies. Whether it's paying our bills, difficult people at work, or family conflicts, everyone is affected by stress. I'd like to tell you about a remarkable healing method called EFT, or Emotional Freedom Techniques. It can help you right now with some of the stress in your life. I'd also like to share with you the stories of some of the millions of people it has helped deal with their own problems, and also the research that is establishing EFT as an evidence-based intervention.
EFT works for reducing the knots in your stomach around life-changing decisions from this big to this big.
Authentic self-connection. EFT is great to lose weight.
I stopped smoking with EFT.
Addictions of all kinds.
I used to have panic attacks. But thanks to EFT, not anymore.
Lifelong depression.
Insomnia.
Releasing fear.
EFT helped my kids with ADD.
Test anxiety.
EFT inspired and supported me through breast cancer.
Fibromyalgia.
Diabetes.
High blood pressure.
Migraine headaches.
Sports performance issues.
Attachment disorders. Removing artist's block.
And it also helped me to understand a terrible water phobia I had. Now I love water.
Hi, as a therapist, I have been looking for the silver bullet all my life, and I have found it with EFT.
The free EFT manuals have been downloaded from the EFT website over 1.3 million times, and today EFT is used by an estimated 6 million people worldwide. EFT uses elements of two well-established psychotherapy methods, exposure therapy and cognitive behavioral therapy. To these it adds the ingredient of the stimulation of the body's acupressure points. This sends calming signals to the parts of the brain involved in responding to fear. When we're anxious or afraid, we have what's called the fight or flight response, which sends cascades of stress hormones like adrenaline and cortisol streaming through our bodies. EFT calms that fight or flight response. The acupoint stimulation sends soothing signals throughout our bodies.
So this is Pinko, and she's what they call a chili rose tarantula, and I have it on good authority from Leanne that she's very kind. I have to say, just being this close to her, I'm actually shaking, my knees are knocking. I've reached out a finger to touch her, so let's see if after the EFT then maybe I might be able to hold her in the palm of my hand.
She's turning to look at you.
She's turning to look at me, oh God. Scared of how I'll react.
Scared of how I'll react.
Scared of how I'll react. Scared of
It worked for Monica.
Sure
Could it work for me?
And she's there.
Been afraid of spiders for 25 years, and now I've got a tarantula walking across my hand.
How does it feel?
She's so gentle, it feels amazing.
The acupoints used in EFT are ones that human beings under stress touch naturally every day. In fact, they're so obvious, we don't even realize we're soothing our anxiety by touching them. The way EFT reduces stress has been the subject of much research. More than 50 researchers have been involved in studying EFT in over 7 countries. EFT studies have been published in more than 15 different peer-reviewed medical and psychology journals, including several published by the American Psychological Association. One study looked at 216 healthcare professionals like doctors, nurses, psychotherapists, chiropractors, and alternative medicine practitioners. It measured their anxiety and depression levels before and after a one-day EFT workshop, and found that their psychological distress decreased by about 45%. One of the most dramatic examples of EFT success comes from the stories of war veterans suffering from post-traumatic stress disorder, or PTSD. There are an estimated 500,000 veterans who've come home from the wars in Iraq and Afghanistan with PTSD. EFT has been used very successfully to help them recover.
It was just a terrible smell of this decomposing body parts. And
so you're taking the helmet out of the bag
and
having to actually clean out the remains of his tissue that were in the... How are you feeling as you describe this now?
I'm feeling pretty neutral. I already did some tapping on this. I'm feeling quite at peace.
In one randomized controlled trial, veterans who got regular medical and psychological care were compared to a group that got EFT in addition to regular care. The results were remarkable. The symptoms of the EFT group dropped into the normal range, while the control group was unchanged. EFT's success with veterans has led to the creation of a support network of life coaches and therapists, offering free or low-cost EFT sessions to veterans and their families. It's called the Iraq Vets Stress Project, and more than 100 EFT providers are available to work with veterans who contact them. EFT isn't only useful for illness. It can also help peak performers. A study of championship basketball players at a major university randomized the teams into 2 groups, after measuring the number of accurate free throws each player could perform. One group then received 15 minutes of EFT, the other received a lesson on basketball tips and techniques written by a famous coach. The 2 groups were then tested again, and those who had received EFT performed 38% better than the control group.
Jorge Reyes trying to relax himself. I don't know if that's acupuncture, acupressure.
One reason EFT is so effective is its effect on your body's main stress hormone, cortisol. Cortisol is intimately involved with the fight or flight response, regulating many of your body's systems like those that raise and lower your blood sugar levels, your heart rate, and your breathing. A randomized controlled trial compared EFT to regular psychotherapy and also just simply relaxing. EFT stimulated the body to reduce cortisol production by 25%. U.S. congressional committees have requested that I testify on EFT's effectiveness, and several congressmen have written letters of support. EFT has also been the subject of scores of stories in newspapers, magazines, on TV shows, and large websites. I believe EFT has as great a potential to revolutionize psychology and medicine as any other great advance over the last millennium. Please visit the EFT website and see stories written by people like you, and find out how they used EFT to reduce their stress and to lead happier lives. You'll also find certified practitioners, EFT workshops, books, DVDs, and a search engine that will allow you to quickly find other people who've used EFT to solve the same problems that are bothering you. You can download the EFT mini manual for free and start using EFT yourself in just a few minutes. Love yourself enough to release those old stuck patterns and claim emotional freedom.